marijuana, the burning weed with its roots in hell.
It is proven that pot makes you dumb.
Marijuana may be the least dangerous recreational drug.
Dangerous, you cannot play with it, it's not funny.
Cannabis works. No chemo. I only did cannabis and the tumors are gone.
Crack babies coming in because pregnant women are smoking this whole marijuana business.
I'm confused. What does cannabis actually do? What does addiction really mean?
Good question. To begin, let's define substance addiction. It is the dependence on the use of a specific substance. It involves a larger dosage of this substance with subsequent uses because a tolerance will build with repeated use. This creates a physical and potentially psychological dependence on a substance. Addiction begins in the brain.
Okay, could you tell me more about the brain?
The brain has 4 lobes: the frontal, parietal, occipital, and temporal lobe. The frontal lobe is involved with executive functions, planning, and decision-making. We will see soon that this lobe is impacted by addiction. When we zoom in, we see that the brain is largely made up of specialized cells called neurons. Information is passed along at connections between neurons called synapses. The information currency are chemicals called neurotransmitters, and there are many neurotransmitters. But of interest to addiction are dopamine, glutamate, and GABA. Dopamine is responsible for feeling reward or pleasure. Glutamate excites the neuron that receives it or makes it also release neurotransmitter. And GABA inhibits the receiving neuron or makes it not release neurotransmitter. Now that we know the basics of the brain, let's return to addiction. The theoretical model of addiction proposed by Kub and Volkow includes 3 phases: initial intoxication, withdrawal, and anticipation. During initial intoxication, the brain regions that release the neurotransmitter dopamine into the brain are hyperactivated, which ties the feeling of pleasure to that drug intake. Next comes withdrawal. In this phase, those brain regions are not activated because the drug is no longer present to cause dopamine release. It is thus harder to find reward, motivation, and engage in normal behaviors. Last is anticipation of the next use. In this phase, the frontal lobe is dysregulated, which leads to less control over impulsiveness and affects decision-making. GABA and glutamate activity is affected, which interferes with normal behavior. Moving to cannabis in particular, we have to ask what cannabis even is. Cannabis is a plant used both recreationally and medically that affects the central nervous system. People who have used it often experience side effects like relaxation, euphoria, touch sensitivity, memory impairment, time distortion, and hunger. THC, the primary cannabinoid transmitter, mimics naturally occurring neurotransmitters in our brain called endocannabinoids and acts on the endocannabinoid receptors like a lock and key. Thus, cannabinoid-based areas of the brain are activated beyond normal physiological levels by using cannabis.
So, does cannabis fit the addiction model?
If we compare empirical cannabis studies with a theoretical addiction model, we do indeed find evidence consistent with the 3 phases of addiction. Research supports the initial intoxication phase, finding that dopamine transmission is stimulated via cannabinoid receptor activity. We also see evidence for withdrawal, the 2nd phase of addiction, in that users showed classic withdrawal symptoms like negative emotionality, impaired sleep, and less motivation within 2 days after the end of use. The 3rd phase, anticipation, also has evidence in that users showed altered working memory and executive function, which links to alterations in the frontal lobe.
Despite the fact that cannabis fits into the addiction model, why do people continue to use it?
Cannabis has been noted to have a wide variety of medical benefits. It has been shown to ease pain for patients suffering from chronic pain. It can help reduce nausea and vomiting in patients undergoing chemotherapy, as well as reduce anxiety in people who suffer from clinical anxiety. And it can stimulate appetite for people with certain illnesses like AIDS. A large quantity of people using cannabis medically experience benefits from it. And for many of them, experiencing relief from their conditions could perhaps make the addictive risks far less of a worry.
So where does all this information put us?
We have seen evidence that cannabis fits into the addiction model. We have also seen that it is not as addictive as most other drugs of abuse. And we've seen that cannabis has several medical benefits. In the end, research exists on both sides of the argument over cannabis's benefits and detriments. It is up to you to weigh the costs and benefits and construct a personal truth.